So here we're going to talk about some fungi that cause infections of the skin. And so we have, of course, our famous ringworm. And the ringworm is a superficial infection not caused by a worm, but caused by fungi, or dermatophytes. And then, of course, we have some fungal agents that can cause discoloration of the skin, whether it is a darkening of the skin in which they have melanin, or if it's a lightening of the skin. Now, the fungus we're going to focus on are the dermatomycosis caused by our dermatophytes, or Candida, which is our yeast. It's a normal flora yeast, and Candida albicans can cause some infections of our skin. Now, we do have some fungus that normally are found on our skin, our normal flora, and one example is Candida. Typically, our bodies are able to control fungal elements. We use our acquired immune response, our T cells, to do this. However, if somebody becomes immune compromised, that's when they typically are going to present with a more invasive fungal infection. And so having a systemic fungal infection is a cause to think about an immune compromised state. Now, for our superficial, there are going to be skin infections. Unbroken skin is often a barrier for preventing, just like our bacteria and our viruses, fungal infections. So cutaneous candidiasis is going to be infection in folds of the skin. It's typically going to be where you have moisture, so a diaper rash, for example. The initial lesions will be papules, and then this is a picture of oral thrush. And this can develop in both infants as well as immune deficient patients, and it's an overgrowth of Candida in the mouth. And again, most people who are colonized with Candida, your immune system will keep this in check so you will not develop something like oral thrush. People who become neutropenic for some reason can develop oral thrush as well, and it could be transient because the neutropenia may be transient. So here is cutaneous candidiasis. This is a mucocutaneous presentation. This individual is an immune-compromised cancer patient. And so the infection of the superficial infection of the hair and skin do not heal. This unfortunate individual has a very disfiguring presentation of Candida, and it's a very uncomfortable presentation of Candida. Now, our dermatophytes are going to be fungi. So Candida is always the yeast. Our dermatophytes are going to be fungus. And they are going to like the skin because they can metabolize keratin. So that makes them stand out. So regardless of which type of dermatophyte or where on your body the dermatophyte is causing the skin infection, they all have that one thing in common. They metabolize keratin. So they're going to cause cutaneous mycoses. These are more superficial, they're not painful or life-threatening. However, they have a presentation, of course. Ringworms are going to be caused by the Teenias, and a ringworm, the redness, whenever you see a presentation like this is caused by your immune system. So it's going to be an infiltration of your white blood cells from the blood, and this causes a leakiness of your red blood cells, and it's going to give this appearance on the skin. So all forms are going to cause an erythema, induration, itching, and scaling. So for the Teenias, we are going to have Teenia capiticus, which is going to affect the scalp. We have jock itch, athlete's foot, caused by crusis and pedias. And these are all going to have hyphae that attach to the skin, and they're going to invade the stratum corneum.